I'm going to talk about the role of indoor air, and just starting a little bit with the prevalence of asthma. We know, how many people know someone with asthma or has asthma? Oh my goodness, almost 100%. So 3 million people in the U.S. Currently have the diagnosis of asthma. We have about 250,000, 250,000 of people who die annually from asthma. English-speaking countries have a higher rate. And within urban areas like Philadelphia, asthma morbidity, so morbidity meaning hospitalization, emergency room visits, and deaths are even higher than in non-urban areas. So about 5 years ago, we actually did a door-to-door screen of over 2,000 homes to look at the prevalence of asthma, primarily north, south, and southwest Philadelphia actually and look at that. And you can see that in some neighborhoods is much higher, but it averages about 26% across all neighborhoods. 19139 was the highest when we did this about 5 years ago. In Children's Hospital, 26% of the children at work had a diagnosis of asthma in the past year. 19% have active asthma. That means that they currently take medications for asthma. So that's 1 out of 5 children have asthma. Now, what is asthma? So I always suggest that you think of the airways as an upside down tree. So you have kind of the trunk and then you have all the branches. And so these are the branches here, the bronchi that we're talking about. If you cut across that branch, you can see what's happening in the airways. This is a normal airway at the top, and the bottom is a asthmatic airway. And the first thing you notice is that the diameter in terms of the tube, see how much more open it is much more open than the diameter of the child with asthma or the person with asthma. And the reason is because in the airway you have inflammation. And inflammation is like a sore, it gets red, and the more it gets infected, the hotter it gets, and the more mucus it produces. So this is, you see, inflammation, which leads to twitchiness, which means your airway easily constricts to triggers, and then increased mucus production. So this is really what you're seeing that really is happening with asthma. You go from a real nice open one and then a pretty close one. The way we tell parents to think about it is to take a deep breath, breathe out, and then take a deep breath and breathe that same breath out through a straw and see how much harder it is to get that breath out. And that's what children with asthma actually experience. So environmental factors clearly play an important role in indoor air quality. Is very important because we spend most of our time indoors. We know that there are genetic factors. So I heard someone saying my mama had asthma and all these people had. So there are genetic factors that may predispose, that means give you a tendency to develop asthma, but actually the expression of those genetic patterns is influenced by the environmental exposures. That's just a quick, and so we get airway inflammation, and we get increased mucus in the lining of the airways. When I see children with symptoms, that's just the tip of the iceberg. What's really going on underneath is the inflammation, leading to the twitchiness, leading to basically obstructive flow. So we want to prevent those symptoms and the way we present those symptoms is starting at the bottom, at airway inflammation. One of the ways we do that, so obviously we do medications, but today we're here to talk about the environment. So we're going to focus on what we do for the environment. So asthma triggers anything that causes irritation or inflammation in the lungs that leads to symptoms. And if you look at this house, there are very many ways where you can be exposed just in a normal house. Even the outdoor air pollutants get in. But in addition, you have mold and bacteria, you have chemical fumes, you have animal hair dander, you have smoke. If you have a wood-burning stove or a gas fireplace, there's a little bit of emission from that as well, and we'll talk a little bit more about that. So again, most of us spend most of our time indoors, and they're the most likely triggers to induce asthma attacks, and also most likely to produce year-round symptoms, and the most difficult to control, and we'll talk about why. Well, the reason why is because it's everywhere. These are the common triggers: dust mite, and we all know everybody has dust mite, cockroach, mice, pets, moles, environmental tobacco smoke, and volatile organic compounds, which we'll talk a little bit about later. When we think about where a child spends most of their time, or a person spends most of their time, when they're not at school or not at work, it's going to be in their bedroom. So we really focus on the bedroom as the most important source of all the triggers, but especially dust. And where do you find it? You find it in carpets, mattresses, pillow covers, pillows, upholstered furniture, and soft toys. And so on the right side, we have the exposure. On the left side, we have what you can do. There's some really simple things you can do. Get mattress and pillow covers, washing your bedclothes in hot water. So every time you change your sheet, make sure you have the hottest linen for those who are sensitive to dust. Removing carpet, especially in the child's bedroom or in the person with asthma bedroom. Stuffed toys in bedrooms, minimize that. And then if you're going to have them, you either wash them weekly or you put them in the freezer. Nobody likes frozen stuffed animals. And then vacuuming carpets while child is outside the room. So cockroaches is the other really common trigger. And any part of the cockroach, dead or alive, is an allergen, so it can cause symptoms. The more you're exposed to it, the more likely you have severe symptoms. And they usually like warm, humid areas, especially with exposed food, such as the kitchen. So what can you do? Poison baits, boric acid, although I have to tell you, 20 years ago when we started classes and we mentioned boric acid, all the parents in the classes laughed at us because they said, oh, roaches eat boric acid, they love it. But so they didn't feel like it was effective, and one of the reasons we kind of turned to some of the poison-based in childproof containers is because of the feedback from the parents. Food and garbage bags, always keeping those sealed in. You know, those are simple things that you don't always think is going to make a difference, but it really does. At the end of the night, if you can just put outside of your house or your apartment, it will help reduce cockroach and mice even. Washing the baseboards in hot water weekly, what that does is that just removes the allergens from the cockroaches. So if they pee, they had saliva along the way, you're just removing all of that. Reducing humidity and wrapping pipe with insulation. Mice we're learning more and more about. Originally, it was thought that cockroaches were the most common indoor air trigger, but we're finding that mice is becoming more of a problem. They're very prevalent in not only in homes, but also in schools. In some studies, the mouse antigen is found more in schools than they are in homes. And the kids who have asthma, who attend these schools with high mouse allergen, they tend to miss more school. So how do you prevent that? You seal every hole you can find, either with some steel wool or caulking, vacuuming a lot. In our program, we give glue traps. We don't use pesticides, and we keep food in sealed containers. So, I'm sorry, animal dander. So, how many people think there's a hypoallergenic dog out there for kids with asthma? There is none. Okay, there is none. If it has any warm blood, if it has any kind of warm blood, it can produce allergens. Cats are the most common pet allergen, and really because they have very sticky dander. It sticks to everything, and it can actually remain in the environment 6 months after removing the cat from the environment. It also travels on clothes. My husband has asthma, and he's really allergic to cats. He can tell within a few minutes of talking to someone if they have a cat at home, because he starts to feel it. So even though you may not have that cat in your arm, you can still have that dander on your clothes. So obviously cats are pets, and there are emotions tied to that. So we would really love for people who have children with asthma to take the cat and give it to a family member. If you can't do that, then we just ask you to keep it out of the bedroom and keep the door locked and not hold the cat. This is the story for several years back. One of our community health workers said, she told me that the cat never goes in the child's bedroom, but I happen to be in the neighborhood And I stopped by and I knocked on the door, and the little boy opened the door with the cat in his arms. So we really don't want that to happen, even though we know that's hard. If you have carpet and upholstered furniture, and if you can get rid of that, it's less likely to stick around. Washing the cat twice weekly, which will probably make it run away, also, and closing vents to the room, and really running HEPA air cleaner helps mostly with pet dander more than anything else. Molds, are in humid areas such as kitchen, bathrooms, refrigerators, and filters, and don't forget to change your filters often. That can be a good harbor source for molds. We like to use humidifiers when children have colds, or sometimes we just feel like it moistens the air, so it helps us breathe better, but that can also harbor mold spores. So if you're going to do that, you have to clean it out regularly, or else you'll be just putting those mold spores in the air. Air conditions help keep the humidity down. Dehumidifiers are really great. And then if you know of any leaks, especially like roof leaks or bathroom leaks, you can eliminate those leaks or fix those leaks. And then cleaning the areas with white vinegar or 10% chlorine bleach solution. But if you do the 10% chlorine bleach solution, you have to have lots of ventilation, and your children shouldn't be around. So we don't really recommend that. So probably the most important, the most prevalent trigger is environmental tobacco smoke. It's a risk factor. It's always bad. It's bad if you're pregnant with a child, or you're bad after the child is born. It's bad if through the life of the child you smoke. It's bad if anyone in the house smokes. So it's a huge risk factor for developing asthma. So remember we talked about earlier about having a genetic tendency, and then environment causes you to express some of that. Well, tobacco smoke will help you express all of your asthma. It increases hospitalization and emergency room visits for children who have asthma, and the more exposure they have, the more likely they are to have attacks. And even exposure to your baby as in utero while you're pregnant can actually put them at risk for lung disease. So obviously keeping home smoke free, keeping the car smoke free. Some people remember the home and not the car, but both should be smoke free. And if you have a smoking addiction, then it's really important to get help. We all know that that's the hardest thing to do is to quit smoking. Any other kind of drug or any kind of thing, quitting smoking is the hardest to do. So there's lots of help out there. And then if you have a child or a person in your family who has asthma and you haven't yet been able to stop smoking, you should smoke outside, wear a smoking jacket or a smoking shirt that you take off immediately. Because third-hand smoke, which is smoke that's just sitting around, is also can produce asthma attacks. So the last trigger I want to talk about, which is not known maybe to a lot of us, is the volatile organic compounds. So VOCs, as we call them, are molecules that easily vaporize at room temperature, and they can come from paints, woods, fabrics, cleaning agents, fresheners, cosmetics. If you have cigarette smokes, it increase some of those emissions. And some of the examples we have up there are, they sound bad because they are bad. Because some of these can cause cancer. Some of these cause lung disease. Some of these cause heart disease. They tend to be higher indoors because of the low ventilation. So if you're especially if you live in a multi-unit dwelling, you don't have control of the heat or the air, you can have very little ventilation, and that makes emissions kind of be higher. And then again, we spend more times indoors. It can be affected, the concentrations can be affected by air exchange rates. If there's building renovations going on, if it's an old house, the size, door and window opening, outdoor VOC levels. And one of the things to remember, even for the newer houses that have everything's sealed and tight, that can actually have higher levels of VOCs because the ventilation's not good. And one study by EPA that looked at 6 different communities found 10 times more VOCs inside than outside. So it's really important to think about that. And where do they hide? This is just a picture. You can see curtains can emit, photographs can emit cleaning supplies, carpets, synthetic rubber, paper products, upholstery fabrics. can emit VOCs. So how do you prevent it? The first thing is just don't let anyone smoke inside your house, because that will increase your levels, increase ventilation, and then really read the labels. Some of the labels are really tiny and hard to read, but try to read them and don't use them against the label. Don't store open containers or unused paints and similar materials within the school or home. Formaldehyde is everywhere, but you can also read about it, so you always want to look at whatever you have and read if formaldehyde is there. And IPM, integrated pest management, if you use, and well, I didn't talk about that, but integrated pest management is when you use safe practices in order to reduce pests in your home, and that will lead to you not having to use pesticides. If you're using cleaning products, make sure you use fresh air. We always use white vinegar because it doesn't cause any problems or no VOCs in that. And there's lots of recipes online how you use white vinegar in what situations. If you have little use quantities, you should throw it away and keep it out of reach of children, and never mix household products together. And then finally, you can look for this label, Designed for the Environment. This is the EPA designation, and it's supposed to be products that are perform well, cost effective, and are safer for the environment. So look for this label on your products. So in summary of this part, we know that asthma triggers are the most likely triggers to cause indoor asthma triggers, the most likely to cause asthma symptoms. Tobacco smoke is the worst one. There's really simple ways that we can incorporate into our daily lives to reduce triggers, and it does require the entire family and community to work together. I don't know how many more minutes I have. Okay, so I wanted to switch gears and just talk about asthma outcomes, because one of the things that I think we're here today is to talk about how our environment affects our lives. And the CDC did this, published this in 1996, in terms of the determinants of health, and you may have heard of that. So what determines our outcomes? A lot of people think it's all biology or all medications, but a lot of it has to do with our environment, and about 20%, but 50% has to do with lifestyle. And when you think about social determinants of health, you're thinking about neighborhood and built environment, health and health care, social and community context, education, and economic stability. And we obviously are talking about the built environment, at least my talk today. So we know that blacks still tend to go to the hospital, tend to die, and tend to have more emergency room visits from asthma. And we really have seen over the time that these social determinants actually are the major reasons why there's just disparities. So genetics loads the gun, but environment pulls the trigger. So we have to be really mindful of this. And poor housing conditions is one of the major reasons why we think there are more hospitalization, emergency room visits. And obviously it requires all sectors to work together in order to reduce these exposures. So what we've sought to do over the years is to understand some of the barriers and then to tailor some of the interventions so that we could improve outcomes. So this is a busy slide. It's not for you to read, but it really is just to show you how the Community Asthma Prevention Program has really tried to incorporate social determinants through community outreach and partnerships, optimize asthma care, research, and advocacy, because we believe that social determinants is really important. And housing, as the United Nations says, is a basic human right. And so because it's a basic human right, it's something that we feel strongly about advocating for better housing for families of children with asthma. Aristotle said, "Tell me how a man died and I'll tell you where he lived." So in asthma, poor housing conditions are associated with more exposure to the triggers we just talked about. So you can kind of see, this is an example of some of the homes that we've been in. And these are all children who've had multiple hospitalizations, emergency room visits, homes. And so what we try to do is to tailor environmental interventions. We do home visits, utilizing community health workers or asthma counselors to teach about asthma, like how do you marry medicine and triggers, prevention, what works best. and really to help them also talk about some of their issues with school and with work, etc. And then we do one-to-one self-management education and integrated care coordination. So here are our goals. I won't read through all of those. We have two of our navigators here, Carmen and Charmaine. We have community classes, we have school classes for children, and we have home environmental trigger reduction education for families. So this is where we put our effort every day. Just gonna go through that real quick. So we, about in 2010, so 7 years ago, we decided our community health workers have been in the community, been doing home visits for a long time, since 1998. And we're celebrating our 20th anniversary this year for the asthma program. But about 7 years ago, we realized that the parents kept telling us, yeah, I hear what you're saying, I got it, but the doctors don't have it, and why don't I feel like I can communicate with the doctor understands me. So we put the community health workers in the offices, and now they are part of the healthcare team. So they, when the children come in, they can talk to the parents, they can teach the parents what the provider just says. If the doctor said take this medicine, they can make sure the parents understand. Or if they have questions, that they feel empowered to ask those questions, like why does my child have to take so much medicine? Those kinds of things to try to close the gap. They also help with scheduling. They help parents set goals for treatment, and they follow them for 1 year. This is what we do. We have 4 home visits, and we do education and environmental intervention at each home visit. And then the outcomes that we look at is symptoms, school days, work days, hospitalization, emergency room visits, and reduced costs. So I'd like to just end with our last study where we had about 200, I don't have my glasses on, but I believe it was 254 children. And we looked at trigger remediation. And you can see at the top, a lot of parents felt that roaches were a problem for their children, pets were a problem for their children. Only about 40% reported a mold problem at baseline, and no one really thought that, no one had done really a lot to think about reducing the dust, even though they believed dust was a trigger. So after education, after supplies given, we saw a big drop in all of those. And pets is the only one to have a big drop. If you can see 39% to 36%, that's always the one that we don't find a drop in, because it's a family member and nobody wants to get rid of their pet, so we understand that. But you can see that these actions, this education does tend to work. And then if you look at this, you can see we had 19% to 80% reduction in all the things that we were focusing on in terms of their symptoms, their activities, their school days missed, and their work days missed. And then if you think about hospitalizations, at the end of the day, we really just don't want them to get hospital, because the more hospitalizations, the more likely they are to die. You can see we saw a big drop from 57 to 70% in all visits for asthma. And then cost-wise, we saved $10,000 per patient by preventing these emergency room visits and hospitalization. So just to end, asthma education, home environmental interventions were successful, they are successful, and we can really empower parents and families to do this. And we target the following social determinants by employing community health workers. They are community members, so we're actually increasing the workforce. We empower the community members, and we address as much as we can some of the poor housing conditions. Thank you.